Research is a fascinating field. I mean, it's aside from hospice work, research has been my favorite thing to do. I think I want to talk about just kind of some of the excitement about research first. Is the wonderful thing about research, it allows you to pose a question and then go find out. You know, you can make an assumption or you can have an idea and then you can find out if it's true. Or you can at least apply a methodology to exploring to see if it's true. And you may have a hunch about the way a patient's reacting to treatment, or about the physiology around stress. And you can say, well, maybe there's a way to deal with this stress. Maybe there's a way to combat the stress. For instance, in meditation, in research into meditation, that's what a lot of the researchers do. I think any nurse who's interested in going into research, I say, go for it. I think one thing that's really important, though, get a good base in clinical skills first. Because any research that you do, or I don't want to say any research, because you can do drug research where it's pretty much, very much focusing on the drug and then it's in a patient population, but it's going to require you to have a really good basis of knowledge in physiology, basis of knowledge in the workings of the body, and in my case, what I studied, the working of the body and the mind. But definitely I think it's worth pursuing. Do it in something maybe that excites you. If you have a particular interest in cancer or in cardiac disease or in pediatrics, then find something about that may interest you. I think one thing that's important to realize is that you have to be around a university setting or at least a research setting. Because small hospitals, I've tried it before, small hospitals aren't set up to be able to do research. It doesn't really work as well. So if you are around a large academic center or around a teaching hospital, get involved in research projects, read on research. Actually, one of the best ways to do it is find something you're interested in, go to PubMed or some of the other, Ovid, some of the other sources of great research data, and read up on it and explore it. It's a great field. I've been lucky because what I researched was actually a little bit more on the kind of the esoteric bent. It was on mind-body medicine. And actually, I did one that was looking at research on non-local healing, on healing at a distance, which is really far out there. The funny thing is, this was funded by the NIH. We got a $2 million grant to look at the effects of distant healing or non-local healing and prayer on people with HIV and AIDS. And so that was a chance to look at some really kind of far out stuff, but do it within the realm of research. And then I also co-principal investigated a study looking at teaching partners of cancer patients compassion. And so I designed the whole program in compassion, and I taught it to these partners, and we wanted to see if the patients had better outcomes, if their partners learned how to be compassionate. So there's a lot of things you can do in research. It's wide open. If you have any inkling, I would definitely suggest check it out, read up on it a little bit, and if it interests you, go for it.